So on surgery day, patients come in the morning. They're seen both by me as well as the anesthesia team and the OR team. We head back to the operating room, and typically these procedures take anywhere from an hour to an hour and a half. They're done through 4 to 5 small incisions that are less than an inch in size. Patients are then up and moving around. They're walking and they're on liquids that day of surgery. And then we advance their diet to, a more thicker diet the next day. And as long as their pain is controlled, their nausea is controlled, they're moving around, they should be able to go home the day after their operation. Most patients actually don't need to go home with a narcotic. We've actually worked really hard with our preoperative process and our medications to sort of make bariatric surgery a narcotic-free sort of process for patients. So we're actually one of the only centers in Richmond that is sort of working towards that and having a narcotic-free bariatric program. Patients actually love it because this is a medication that obviously is dangerous, it's addictive, and if we don't have to use it, then that's great, we don't use it. We don't want patients just laying in bed. They need to be up, they need to be active, and for the most part, they're back to their normal routine, aside from some physical restrictions. We ask that the patients not lift anything more than 25 pounds for the first 3 to 4 weeks after surgery, but they're typically able to drive. Most of them that have sedentary jobs, or they're at a desk or at a computer, and they can have their fluids with them, are able to go back to work 2 to 3 weeks after surgery. They're able to shower like normal. There's no additional equipment or anything that's necessary at home that they need to purchase prior to getting their surgery. We give the patients a manual as to how to advance their diet over 4 to 6 months after surgery. There is a strict regimen to how we advance their diet. However, there are a lot of options available to them at each phase in their diet advancement, and that's one of the advantages of having a dietitian on staff in our office. She's always available to the patients, either by phone or an in-person meeting with them, to sort of guide patients with specific dietary restrictions, dietary allergies, to make the right choices in each phase.